My 2 young children and my husband and I were in Disney World, and we had a great time for a few days in Disney. The last day of our trip, we went into the hotel room, laid down, exhausted, and I ran my hand across the top of my tank top and felt a lump in my left breast. Returning to DFW, I went in to see Dr. Allen, who then sent me for a mammogram.
And I think it's important that for patients, if they feel a breast mass, that they get in, have it evaluated. Sometimes that's imaging studies, sometimes that's ultrasound, sometimes that might be a MRI. Some of these are benign things that maybe it's a cyst that needs to be drained, so maybe it's a little fibroadenoma that just needs to be watched, but sometimes they'll be breast cancers.
When I saw Dr. Allen, he sent me for a mammogram and an ultrasound just to get a better look at the lump. After the mammogram and the ultrasound, I got the results in the mail saying that it wasn't anything to worry about. They felt like it was a fibroid adenoma, and to come back for another mammogram in a year. And at that point, Dr. Allen, I feel like, changed my life because he didn't accept that. And he went ahead and sent me to a breast surgeon just to make sure. And
I want the breast surgeon to make a decision on the patient. I want them to decide. They're the ones that usually have the experience to say, I can watch this, I need to biopsy this. And a lot of times they go over these risks and benefits with the patient as well, and they'll be able to give them some guidance on which way to go.
After going to the breast surgeon, she said she felt like it was a fibroadenoma, but because of the size of the tumor, she wanted to go ahead and take it out. When she took it out, that's when we found out that it was a very aggressive form of breast cancer. I was only 34 when I initially found it. I was staged at a 2A, so it was relatively early, but because Dr. Allen pushed and didn't just stop with the results of the mammogram, I feel like he saved my life.